Okay, guys, in today's lecture, we'll be talking about patent ductus arteriosus. And if I may ask, does anyone here know what is ductus arteriosus? Ductus arteriosus is like a linkage between the pulmonary trunk and the aorta. All right, and the patency of this duct, that means the duct is supposed to close after birth, but it is not closing. Okay, so what is ductus arteriosus? Okay, the patency. How can you be able to diagnose it in a child? Okay, how can you be able to diagnose it and know that this child has patent ductus arteriosus? So diagnosis and discussion of the patent ductus arteriosus is what we'll be doing in this lecture. The question is, a 7-year-old boy tires easily while running. On auscultation, harsh continuous machinery murmur is heard at the left side of the sternum. Left side of the sternum, you know that the heart is on the left side. Okay, all right. Now it is heard on the left side of the sternum between the two ribs. Okay, that's the upper part of the heart. Arterial blood oxygen content is slightly higher in the right hand than in the left hand. X-ray of the chest shows no abnormality. Of course, X-ray is focused at bones. X-ray cannot really show you deformities in muscles or tendons. Okay, so you won't easily see a deformity in muscles or tendons. So, what congenital abnormality do you suspect that this child has? And briefly discuss this congenital abnormality. So, guys, can you see that in a normal heart, the ductus arteriosus is closed, all right? While a patient with patent ductus arteriosus, it is like open. Okay, there's an opening and a shunting of blood from the aorta into the pulmonary trunk. Okay, which is supposed to be a one-way flow, but this blood, oxygenated blood, is now coming back. Okay, into the pulmonary trunk that has deoxygenated blood. Okay. So the answer is a congenital. The congenital abnormality is patent ductus arteriosus. Okay, and it's a heart defect caused by problems in heart development. Okay, that's failure of ductus arteriosus to close. Okay, so patent ductus arteriosus is an opening between two blood vessels leading from the heart. Those are the great vessels of the heart. Those are the aorta and the pulmonary trunk. So a patent ductus arteriosus may cause no symptoms, but a large one may cause poor eating and failure to thrive or breathlessness. Okay, so that was the what harsh machinery murmur that was heard from this child. Okay, so this is it, and this is a patent ductus arteriosus. There's actually a linkage between the aorta and the pulmonary artery or the pulmonary trunk. And the pulmonary trunk, okay, you know that there's deoxygenated blood from the right ventricle into it, while the aorta there is oxygenated blood from the left ventricle pumped into it. Okay, so now oxygenated blood is now flowing to mix with deoxygenated blood. Okay, so you have breathing problems. Okay, so that's it about the diagnosis of patent ductus arteriosus, and I hope you guys enjoy this tutorial. See you guys in the next one. Bye for now.